Two U.S. pharmacy chains are gearing up to give out COVID-19 vaccines as soon as one gets a green light from the FDA. Mandy Gaither takes a look at how the distribution will work and how they will keep track of those they inoculate.
Healthcare workers and long-term care facility residents are set to get the first COVID vaccinations in the U.S.
Our plan is to be ready to go as early as December 15th, waiting for the state approvals.
In October, the Trump administration announced agreements with CVS and Walgreens to vaccinate residents of long-term care facilities nationwide. The pharmacy chains already have a list of those organizations, says Dr. Troy Brennan, Chief Medical Officer for CVS Health.
We've basically got 31,000 locations where we're going to have to be doing the vaccination, and that's about 2 million patients. So we know who it is, where they are, and how many patients there are.
CVS plans to send teams to each of the facilities 3 times in the coming months. A team will consist of 2 vaccinators and 1 support staffer on average. Brennan says they're already working out details for vaccine distribution within each state and looking ahead.
Once we get into sort of general distribution, I suspect that not only ourselves and Walgreens, but there's going to be a number of other pharmacy chains and grocers who will be involved in it. And I think that using all those various outlets, we're going to have very good penetration across the United States. You'll get an appointment for both your first vaccination, your second vaccination, and then we will keep after you to make sure you come back for that second vaccination.
For today's Health Minute, I'm Mandy Gaither.
Brennan says the skilled nursing facilities have already made a decision about whether to work with CVS or Walgreens. According to him, the decision was based on which pharmacies are more prevalent in their area. Kroger is also preparing to vaccinate people at its pharmacies. Take a look at this graphic. An update from the Institute of Health Metrics and Evaluation this morning projects more than 500,000 COVID deaths by April. Data suggests daily deaths will peak in the range of 3,000 in mid-January before gradually falling. The model covers primarily the period before vaccines are expected to be widely available to the public. The model argues that if everyone wore masks, more than 66,000 American lives could be saved.